Hello, I'm Shannon Brinker. I am so excited tonight to really share with you how we're going to master isolation techniques. And when we go through this presentation, this was kind of tough, I'll be honest. Really trying to go through lots of different devices that you can use in your practice. But most importantly, how can we as dental assistants, and I know we've got a lot of doctors on here tonight, and we even have some hygienists on here, thinking about our confidence that we have and making sure that that first of all, we have an area that the doctor can see and that we can see, but it really truly is a dance. And again, with the expansion of our duties as assistants, and I am a dental assistant, I have been for 34 years. And if you have never heard my course, I will tell you that I do a lot here with Viva. And I will say that I want to help you to understand the differences between a lot of different devices that you could utilize. But most importantly, I want you to know what are some of the best devices that you could be using. And so without further ado, let's get started. So what are we going to learn tonight? We're going to talk about the benefits of utilizing isolation tools and really how do we improve the patient care. Efficiency is so important, and I get that. I know that time is the one thing in dentistry that we do not have enough of. But I will say that when we consider a lot of the devices tonight that I'm going to go through, I'm going to be really brutally honest. That's the only way I know how to do things. And I'm going to tell you, there are some out there that are really good, and there are some that as a patient myself, I've had full mouth reconstruction. I can tell you some are more comfortable than others, but most importantly, I'm always thinking about my dentist, and that's just what we should be doing as dental assistants. And so we're going to talk a lot about what are some of the differences and really some of the things that maybe my doctor and his feedback and my hygienist and her feedback. We're going to look at some of those procedures where we really need different types of devices to help us to be able to see, but most importantly, to buy us more time, right? Because a lot of the things that we're doing bonded adhesion, and we've got to make sure that we have significant moisture control. It's really important. The other thing is that we got to look at the wear and tear on our bodies. Now, I will say that, most of the time I hear a lot of hygienists talk and very vocal about ergonomics. I don't even think I know a dental assistant speaker that talks about ergonomics. But I will tell you that, for us as dental assistants, we really and truly have to fight to be able to see. I mean, I've sacrificed my body for 34 years because I worked with a dentist, no offense, that sat at the 12 o'clock versus where he really should be, but he is the doctor. And so there were probably 90% of the time in my life where I've had to stand. And so this is where I want to talk a little bit tonight about ergonomics and most importantly, how we can save our bodies so you're not like me and almost crippled at 34, right? Going on 35 years of dentistry. We're going to talk and really, I don't want to say poo-poo tonight, cotton rolls. I am a big rubber dam lover. I will say that I'm probably the only one out of all of our professionals that we speak to, but most importantly, we know sometimes we don't have that kind of time. And so we're going to talk about that modern isolation and what are those approaches that we really mean here, and then really show you how do we utilize each product and highlight, again, that good and bad. Then we're going to troubleshoot a little bit. And I think this is where, troubleshooting, giving you some best practices, some of the things that we've seen, but most importantly, I'm always thinking about the comfort for those patients. And how can we, really look at, multiple chairs. Now, the one thing that I'm going to bring to you tonight is a lot of different areas where I've worked in large practice. We had 7 hygienists, 5 dentists, and 61 team members. So we have to look at budgets. We've got to look at what things cost, but we also have to measure that with time savings. So we're going to kind of go through some of that tonight. And again, at the end of the day, you're going to choose what works best for you, but you're here tonight for me to kind of showcase what are the possibilities and why do I utilize the products that I'm using, because I want to help you be very efficient. Now, before we really jump into all of those products, I want to start off reminding you of really what we should still be, even after COVID and all the shutdowns. We still have to remind ourselves about aerosols. This is something that, again, I think since COVID is over, we're not really looking at things. And yes, this is a big, funny photo over here to the right, but we still need to be thinking about what are we utilizing? And again, looking at those aerosols. And when we think about that, again, reminding my team constantly, the smaller particles, 0.5 to 0.10 microns in diameter, have the most potential to penetrate and lodge in the smaller passages of the lungs. I want to remind you of this. So many people really and truly have forgotten about protection when it comes to the aerosols. And so for those that maybe didn't get that, and even our younger assistants, younger dental team members, we're going to really go through that tonight before we start with anything, and reminding you of what should we be utilizing, and most importantly, thinking about yourself. That's really important in this day and age, especially now with tuberculosis being out there, looking at, a lot of things. Again, first of all, you don't really remember all of these things. And so for me, I thought, well, if I'm going to put this together, I want to go back and just remind you of what we really should be reminded of. And when we look at this, if a virus is on the surface, it does not necessarily mean that it is infectious or mean that you can't go in and out of the dental op. But what I want you to think about is staying 6 feet out. Let's stay in the air. These things stay in the air 3 to 6 hours. So anything that's floating, it can stay in the air 3 to 6 hours. Now you say, Shannon, infection control. Well, listen, infection control is not my thing, right? I've got other besties out there like Michelle Strange that this is their wheelhouse. But this hit home, and it always has. I'm always thinking about what's in the air, what could still be in my practice, on my desktop, anywhere, on my tabletop, any place that maybe I did not think about that I would be taking home. And this is where we have to still, this day and age, be cautious, keep aerosols to a minimum, and making sure that we're doing everything we can, but most importantly, protecting ourselves. And that is something that, again, sometimes we're just not reminded about this. The other thing is that when we talk about advanced isolation, and that's really what tonight is about, I want to think about the dentists and the assistants. We know that, again, we hear a lot of this with hygienists, but my face is right and has been in front of that high-speed handpiece for 34 years. Now, I will tell you that now I get a lot of sinus infections. I've had a lot of issues. Now, I don't know if that's because of the acrylic or maybe the adhesive that we use when we used to paint our impression trays. Who knows? But our face is right in front of that handpiece at all times. So it's not just one team member, it's all of us. The use of those handpieces, ultrasonic scalers, air water syringes create a visible spray that contains large particles, droplets of water, blood, microorganisms, debris. The splatter travels a short distance and settles out on the floor because it's heavier. Those large particles come out and drop immediately on the floor. The smaller particles are the ones we need to be really worried about. The ones I told you about that flow in the air. Don't think that, oh my gosh, we cleaned everything, we wiped everything down, we covered everything. It's still lurking. I just want you to be reminded of that tonight. Right? Now, when we look at this, I always just show this, and then we're going to jump into the spray. It may contain aerosols that can remain airborne. Again, I'm going to say it one more time, for extended periods of time, and can be inhaled. Even though we're wearing a mask, one of the things that I see a lot is still, people wearing their mask underneath, not wearing the mask on the nose the way we should. We need to be reminded of these things. Again, we're only human, but those large particle splatter that make up the bulk of these sprays, from handpieces, ultrasonic scalers, high-speed evacuation, anything that really can help us with that aerosol at a higher degree is very important. And I'm going to focus on this tonight because, again, I'm here to remind you and make sure that you do understand and don't forget, okay? Now, when we talk about advanced isolation, we're going to talk first about the first types, right? You say, Shannon, it's so elementary. I know that, but let's go back just a little bit. Regardless of what I use, I want to make sure that I'm using something for isolation. But I know that, again, certain practices have budgets. But again, what I want to kind of go through tonight is there's all different types of isolation But isolation should be an easy, comfortable process. And one of the things that's really important is being consistent. That's what I want you to think about. Patients in this day and age are always sizing us up. I want to make sure that they're comfortable, but again, I'm using whatever I'm using is giving me the best optimal visibility. Moisture control is going to help with efficiency and most importantly, help us with results. So let's talk a little bit about these. Now, the first thing we know is cotton rolls. Now, listen, so many of us, again, cotton rolls, I love Richmond cotton rolls, but I can tell you that in this day and age, I don't hardly use any cotton rolls anymore. I mean that. And it's nothing because, listen, I have great friends that work for Richmond. It's family owned and operated. I support it 100%. But I can tell you that for me, I think younger assistants, and the more that I'm training younger assistants, I'm like, I never knew what I didn't know. We got to get those lips out of the way so we've got visibility. Again, I'm bent over looking down into the patient's mouth. And yes, cotton rolls and shin, they're very absorbent, right? But I also suck them up in my younger assistants right now when I go to a high school that has an assisting training there. Oh my gosh, I can't tell you, sucking things up, but most importantly, I want you to have the visibility. You don't know what you're missing, right? And again, I know for those dentists that are here in Shannon, I love cotton rolls, we're using it, but tonight is about what else can you be utilizing? And that's what I want you. And again, it's nothing against the cotton rolls, but I feel like we're working so hard. We're trying to really expedite that patient's visit, but most importantly, be very efficient. But at the end of the day, it is a business. And in my practice, we try to do is, we want to make sure that, yes, the patient might be there a little bit longer, but we want to work in quadrants. We want to try to get as much done in one appointment. And most importantly, that is smart in this day and age, not come in and do onesie twosies anymore. But we can't do that, honestly, in this day and age with just using cotton rolls anymore. We need that complete full mouth visibility pretty much with everything that we're doing now. And that's what really tonight is about. Again, remembering this, when I was training assistants, I'm like, well, you don't need to worry about this anymore because we're going to use isolation devices, that get things out of the way for us. And that's, again, what I want you to know, and again, it's not here to poo-poo cotton rolls. It's not to say anything bad about, our dry angles and those types of things. A lot of people use these, but again, going back to, you don't know what you don't know until you see something that can make your life so much better. And that's what I want us to really focus on. Also, when we look at suction devices and saliva ejectors, one of the things that I got to be honest with you about is, just looking at what we're doing, but most importantly, if I had to go back and look at old video, and I do this actually on my online school when we're training assistants, when I look at this and I'm like, oh my gosh, I can't tell you how many times we would shoot video and I would go back to look at the video and I would be like, oh my gosh, I cut that patient's tissue with a saliva ejector. I mean that. A patient would have a canker sore because we would bend that saliva ejector and put it underneath the tongue. And when I see that in this day and age, I'm like, oh gosh, you have no idea what you're doing. Really thinking about HVE and the sharp, they're all cut by a machine. They're not polished or manicured. And again, when you're a new assistant or a new hygienist, you just don't really know those things. And so this is where, again, I want you to really be careful and really pay attention to the tissue. And most importantly, in this day and age, we don't really have to worry about that as much, right? And again, tonight, what I want you to see is, when we're using these HVEs, and thinking about all the ones out there. Now, I am going to back up just a little bit. I want to tell you that there are a lot of really good, I know all of us are going to have them. We're all going to have saliva ejectors. We're all going to have HVEs. But I want to point out a few things here. The one to the upper left is a swivel HVE, which I thought was a really great idea. This was actually developed by a dentist. Saliva ejectors, they come a dime a dozen, right? But be careful and make sure that the cheaper, the most economical those saliva ejectors are, the sharper they may be. Okay. And I mean that. So this is where you really want to look at and just look at it, feel it with your fingers. Anytime we're looking, and listen, it is about budget. I get it because listen, I'm a partner in the dental office. I know, but I don't have gloves on when I want to feel it. I want to feel if it's sharp, especially if we're going to be changing saliva ejectors, they can be sharp. But scrolling on over to the one that has the green and the blue, this is a silicone end. And if I'm going to use a HVE, This is the one of choice for me. I love this one. It actually is made by a dentist. Inside, the screen is inside of the suction, which I thought was really, really great. And this is called the SafeVac. And it is a really, listen, I would not use any other suction device, HVE, straight suction. And this is the one of choice. So I just want you to know that. Anyway, part of the training that we do is really training assistants where that suction should be. And one of the things that I always want to do is give you a refresher of that. And I'm not going to spend more than 2 seconds on this. But sometimes, again, if we're working with a doctor that does jump around, and I have, no offense to my doctor, but he knows he jumps around because I told him he jumps around. But one of the things that's really important is for you, for the dentists that are on tonight, and then for the assistants, and sometimes even our hygienist has to jump in and suction, it is nice to have a refresher as to where really should my suction be. And in a great world, where would I have wanted that to be? And this is going to really play a part as we get into the devices of how great this is to have some of the devices that we're going to talk about, some of those advanced devices. The first one that we're going to showcase tonight is called the Lingua Guard. The Lingua Guard is a little plastic piece that actually fits on the end of those cheaper HVE suctions. And I will say that for me, this one was one that I really was made privy to actually doing a live patient with a good friend of mine who's a dentist. And I will tell you that, it was great for the anterior. I could kind of just almost go to sleep. After you go to lunch, you have that turkey sandwich and you're like, oh, I'm so sleepy. This was good. But when you look at it and we try to use it posterior, it was really tough. And so when I'm looking at devices, and again, tonight, I'm sponsored by Xyrus, but I will tell you that I have all the right to talk about whatever I feel you really need. And as a clinician, I want to be honest with you to tell you that, and they know that, I've told them, the anterior area was good, but trying to pull the tongue back and really fight somebody who has that tongue that you want to cut off and put in a jar in the back, this was hard for me. But this is basically a plastic piece that fits on the end. And again, it was good for the anterior, but really tough to hold the tongue back. And so this is called the Lingua Guard. Now, let's talk a little bit about some of the other ones out there, okay? And I'm going to come back here for this. I'm sorry, I hit the screen too soon. When we talk about advanced isolation, okay, and we've already talked about all the conventional suction devices, and now we're going to get into some of those that will give us a little bit more visibility. We talk about advanced. We've got advantages to these. Patient is protected. That's really important. Again, the visibility to me is very important, but probably the most important thing, really. And again, being efficient, right? Being efficient. Again, with 25 ops, we don't have time for that. We got to get in there and get everything done. And again, we do try to work as fast as we can and be efficient, but we need help. And most importantly, having moisture control. We're bonding. Most time we're bonding, even when we're placing attachments or we're doing, everything is really controlled. And when you think about failure when it comes to bonding, 99% of the time it's because there was saliva somewhere that contaminated our area of direct resin, right, or direct bonding. So moisture control is really important. And again, having the infection control. The disadvantage is sometimes is we feel that it's time consuming for some of these, but remember, everything in dentistry is repetition. The more you do it, the more you use it. One of the things that I learned working as an evaluator for Michael Miller in Reality Publishing many years ago is he said, Shannon, you cannot evaluate a product after using it 5 times. You at least, that's the rule of thumb, you got to use it 5 times before you can really give it an evaluation. But one of the things that I know is that if we can get used to using it, especially for dentists that are out there that say, Shannon, it's the hardest thing for us to get our team trained. Well, you just got to keep pushing them and they've got to use it several times. Again, everything in dentistry is repetition. The more we do it, it's just like taking photos, using the scanner. The more we do it all day long, every single day, that time is going to be nothing, right? Patient objectives. Again, going back to, if you use it on every procedure, patients, again, it's repetition. It's just like taking photos. The first time we take pictures on a patient, they're like, what are y'all doing, right? But after that, I'm going to get my photos. We're getting ready to take these pictures. We're going to do this. It's patients get used to it. We're almost training those patients. So those objectives really go away. And this is where you got to be consistent. and making sure that, again, if you're going to use rubber dam, but most practices don't, I would say it's anywhere from 4 to 6% of the offices, you got to use the next best thing. Okay. And then some of the times it's hard for us to really look at all these other areas, but I just want to kind of throw that in there. Where do we know advanced isolation shines? Pretty much every area. Posterior composites, doing sealants, preparation, delivery, CAD/CAM. Now, one of the things that I will say is it is hard to do scanning of a full mouth. Okay, that's something I cannot lie to you about. The hardest thing sometimes is using some of these devices and being able to get a complete scan. And I teach for iTero, so I'm going to be brutally honest. And I've taught probably 60,000 dental team members when it comes to attachment placement and anything else that has to do with Invisalign. And I won't lie to you, it is hard. But all the other areas of dentistry that we can use these for, these things shine, right? So let's talk about that again. We already went through it. Let's jump right in to the next one. This one is called the Relief. Now, I will say that a lot of hygienists love this product. For me, it's really hard to utilize in the operative chair. But again, hygienists love it. And again, a couple things about it is the patient can close on it. Again, using ultrasonic. If a patient, it's just like a little leaf, it's almost like a dry angle, but it has a little device. It does hang off the patient's lip, okay? But their claim is that you can close on it, which yes, you can. But if you've got a ultrasonic that really belongs in the Smithsonian, let's be honest, they're very expensive. I get it. That this might not suck up enough of that saliva and that water that's coming out of the ultrasonic. So I just want you to be aware of it. And remember, going back to some of the aerosols and what do we really make sure of? Again, that's something that I want you to think of. And then, yes, I do like the Relief. I have used it, but that's what I want you to really be thinking about. There's also one called the Dry Shield. The Dry Shield basically hooks onto your suction device. There isn't a light to this. So I want to, make that known. It basically is the same thing, goes into your high-speed suction here. And again, it's comfortable. It has a little bite block, but hard to see unless you really got that light shining in there from the overhead or you're utilizing your loops, all right? This one is called Mr. Thirsty. This is from a company called Zerk. Mr. Thirsty is basically a disposable device that just kind of fits in there as well. And again, just goes all the way back to the back of the throat, just slides right onto the patient. But I will say that, it comes in 2 sizes, only 2 sizes. So it's definitely not a one size fits all. Now, one of the things that they say is that you can cut it, but in my practice, a lot of times we're not going to use scissors to cut those right there at the chair. So I just want to showcase it. But again, it is a good product. And it's from Zerk. And again, has, again, a larger size and a smaller size, but just 2. This one is called the Pure Vac. And I will tell you that my hygienist did like this, but only one hygienist out of the 7. The Pure Vac basically is an evacuation hose with a mirror on the end. Now, since then, there's been a lot of different products that have been released. And so this one here, again, from Den Supply, a lot of hygienists do like it. For me, no. And I want to tell you why. I'm going to back up. I'm going to show you why. Do you see the hose that's on this? One of the things that is tough about the hose is really hard to hold. It's very stiff. So my hygienists, again, they're not used to having to turn that wrist around and move around, I think more like an assistant. And so for me, the hose was what did it. The hose was very hard, straight up. And again, hard to really bend and be a little bit more flexible, I think, for a dental assistant, but again, some hygienists really like it, but I want something that I know I can move and most importantly moves with me. And again, we're doing a lot of different things in the mouth when we talk about procedure wise that I just felt like it really wasn't something that I would use as a dental assistant. But you know what? I want you to know the difference. But this one I will say is the Mercedes, probably the Ferrari of all isolation devices. And I'm going to tell you the reasons why. And I really and truly have 2 Isolites. I had the very first generation. Then I got the Isolite 3, and then I got the Isolite Pro. And I'm going to tell you the reason why I do like this product a lot is because it was in my own mouth. I have a lot of bite issues, a lot of joint pain. I have full mouth reconstruction. Yes, I work with John Cranham in the Dawson Academy. I got to lecture with Pete Dawson. And I'm going to share with you that one of the things that I want you to always be aware of is what are you putting in the patient's mouth that could cause harm long term. Now, think about this. When you're putting something in the patient's mouth, we got to make sure, especially for those lengthy procedures, for someone like me. I remember the last time my teeth were prepped, my doctor cut off 10 zirconia restorations. I was in the chair for almost 7.5 hours. 7.5 hours. That's a long time. And so this is, you say, Shannon, why are you comparing that? Well, let me share with you some of the things that I love about the Isolite, but why I feel like this is something that, again, we need to know about. So when we think about the Isolite, a couple of things that, again, I want to just kind of mention is that it first of all has an LED on it. That's what is probably the best component of it. Being able to have light and different levels of light, which is what I'm going to show you here in just a few minutes. But most importantly, now we can turn off. We don't have to worry about things setting up quickly. And what I also love now is kind of the dual level vacuum control. And we're going to get into that in just a few minutes. But I want to make sure that, again, this non-curing, the amber light really provides us to have full illumination and really great visibility without that, you know. And so sometimes we're fighting for visibility. Again, going back to dental assistants and dentists, my doctor has his own light and he can see in there, but there are times when it's really tough for me to see. And the older that I get, and I'm going to be honest with you, the older that I get, and I don't know if it's because I looked at curing lights maybe too much, maybe not following the rules with, you know, having a shield all the time. And I remember my doctor said, well, Shannon, I only need your eyes for about another 10 years and I'm going to retire. Well, the older that I'm getting, I can't see. And again, all of us go through that. And I need that illumination. So this is where I want you to really know the difference. And again, having something that is detachable and that I can really see. But most importantly, I'm able to move the hoses and I can have my slave ejector. I can have my high volume suction. And with the dual components of this vacuum control, now I can actually have this in the holder as well. And I want to share with you what is the best about it. And again, we talked about those lots of procedures that we can utilize this on. And so I want to just make sure that you know that right now, I will say more and more hygienists are asking for this. And I think a lot of it has to do, again, with the air polishing. You know, we're not doing this selective polishing like they're doing anymore. Almost every single hygienist that I know and all my friends, especially my own practice, they're doing a lot of air polishing. And this is really the answer to help suck a lot of that aerosol out. And so, again, it's like you don't know what you don't know until you're utilizing it. Now, let me share with you a couple of things about the Isolite Pro. And I want to make sure that you know this because when I was talking to some of my friends just a week ago, some of my friends who are assistants and teach assistants, they did not know all the different components that come with the Isolite. The first thing is that, again, having that illuminated head, we've got 6 posterior vacuum. We've got the little pipes that you can, you know, add your little device to, and I'm going to show you that in just a minute. The 6 anterior. This is new. We didn't have this before. So now we've got almost like an anterior retractor. And like I said, Brenda, my really good friend who teaches digital scanning, she said, I didn't even know they had that for anterior. And I was like, yes. I'm like, you got to check into this. And she was like, wow, I did not know that. So let's show you just a little bit about this real quick. Again, you got a posterior and you have anterior. Okay. And what I want to just kind of show you is, again, no matter what area of the mouth that you're utilizing, you can do, you just switch out just the adapters really quickly. They're right there at the chair. And this is what we're doing. You can do bonded techniques. Again, this is the posterior and the anterior. Okay. And so again, having both of those, a lot of people don't know. They're just so used to seeing the posterior, not even knowing about the anterior. So let's jump into it really quickly. How does this work? So super easy. I just did Dr. Corman's office not even a week ago, showing them this is what you do. It's got a little tiny hose. We're going to hook that right into the connector. This is how simple it is. This little piece pops right into the hose. And I did cut mine to make it just a little bit shorter because I like a little bit shorter hoses. I like hoses that lay on the floor. And then we're going to plug the electrical in. Now, you do need to plug it in. Remember, we want to take advantage of the illumination. So we had to actually put a little view box underneath right on the floor. And then we'll just attach our hose right into that power connector. And now we're going to attach our vacuum base to it. We're going to twist it. We're going to make sure that the light is on. And again, making sure that it's solid blue. But this is what is so cool. You see how you've got this 4 holder. Now we're going to connect that Isolite 3 or what we say the Isolite Pro to it, okay? Super easy. So what I want you to really think about here is, again, having that, how fast can we get this, okay? Turning it on. And again, having that 4 areas. Now, I'm going to tell you that Shannon uses the one that is lit up all the time. But the beauty is this is where we would actually turn it off and turn it on, where you could have dual suctions or just have the Isolite going. And I'm going to share that with you here, which is really great because a lot of dentists will ask me, well, how do you do that and have, your HVE? And I'm like, well, that's what the dial is for. You really can make a decision pretty quickly of what you want to use. If we're going to use the Isolite the whole time, or I'm just going to full power, or do I just want to be able to use the Isolite and my HVE? And so this is what's great now about the difference between that very first generation that I had and again, having now the illumination and being able to control that. So step by step, I'm going to tell you, nobody I've ever seen. Now, in dentistry, we do not read. We don't read anything, right? I mean, honestly, we don't read at all. If there's not photos, it makes it really tough. And you're lying to me if you say, yes, and I read everything. Okay, go ahead and tell me that, but I know better, right? But I love the diagrams. The diagrams in the box are amazing. I really wish I could show you, and every manufacturer needs to follow their suit. I mean, it is a no-brainer. I mean, really, they make it super, super easy for you. The other thing is again, if you don't need that amber light, that's what the switch is for. You can turn it on or turn it off at any given time, which is really nice. But here is probably the best part, is having different sizes. Okay, now this is something that, again, remember going back to the other competitor only has 2 sizes. This one, again, we've got pediatric, we have an extra small, a small, medium, and then we've got, again, getting bigger and bigger because we do have these tongues. Oh my gosh, right? So this is something that, again, thinking about the size of your patient, but how do we really make sure we don't make a mistake? Because these are a one-time use and they are disposable. And this is a question that I get a lot from dentists, okay? And they're like, Shannon, I really want to order this, but I don't want to waste them. Well, doctor, just follow and have your team and have your assistant watch this video and follow directions. So what did I do? I grabbed my little Dexter, put them all right onto my seat. And I want you to really know, here is what I do, okay? On the back of the box, yes, they tell you, hey, put your fingers there, do a measurement. But I want to show you exactly what I do, because if you put your fingers right up to the patient, they're not going to really open to maximum capacity. So this is where you almost have to do this. And I'm going to tell you, yes, I do it every single time. But what I'm doing is I'm going to, again, this is a Dexter, right? But I'm going to take my fingers and I'm going to just place them right into the patient's mouth. And I do explain to them what we're going to be doing today. And I'm like, listen, you're going to love it. But what I will do is put my 2 fingers, and I would tell you, I do crank them up a little bit. I don't want to crank them up too. Again, going back to the jaw joint and those patients that might have joint issues, very, very important to make sure that we're not cranking them open with something. But one of the things about this Isolite is the fact that it is a really comfortable device. And I will say that my husband has a lot of jaw issues as well, but he's petrified of the dental office. I mean, he's the only man I know that literally truly has to come with workout gear because he sweats so much to just even sit in the chair and do whitening, okay? And even to this day, it doesn't matter how many years we've been together, he's still scared. But I will say one of the things he told me, he says, it's something about biting down on that device that really made me comfortable. It took away my anxiety. And I was like, oh my gosh, that's crazy. I never really had someone explain that to me. And he said, I felt like, it just kind of took my mind off of it because now I could bite down on something. And again, all of the gag reflex for him, and most importantly, some of the anxiety was gone. And I want you to really think about that. So how do we use it? The first thing we want to do is we're going to put a little bit of Vaseline or chapstick we use chapstick. We buy it on Amazon. We get it in bulk. You can really get anything, but we give it away to the patient. Now, you don't want to buy anything that's labeled. Trust me, they use it one time, they're not going to remember your name on it. Don't pay the money for that. Just buy cheap, chapstick, but most importantly, you want chapstick that melts. I don't use as much Vaseline anymore, only because I just don't want that Vaseline all over everything. And one of the things that I think is really important is just making sure that we do give patients chapstick before we start. The other thing is I like to lubricate the bite device just with a little bit of water on the inside to make it smoother to go in the patient's mouth. And now one of the things you don't want to do is do that and then attach it. You want to really have that attached and then spray it. But I just wanted to share with you exactly, if you've never done it before, how does that work? Okay, and I'm going to pause this one. So I'm going to spray the inside, and then I'm just going to attach it to the posterior device. Super easy. What it does is you want to pay attention to the little notches on the underneath, and that's got to fit right in. Now, sometimes if you spray it ahead of time, it's kind of slippery, right? So ask me how I know. So now what I do, and again, troubleshooting, is I will place it on the device and then spray it, okay? But again, you want to push it on there, make sure that it really snaps onto those two little places underneath, all right? Now, you can see that, again, I measured the patient, I placed it on there, I added some water for lubricant, got some chapstick for the patient's lip, and now we're going to place it, okay? The easiest thing to do is to just slide it in on the occlusal arch. So here I'm going to show you, I might type it on, and then I'm going to show you live. So we're going to just kind of fold it. This rubber is so comfortable, you can easily just maneuver it, but I'm going to glide it. I start in almost like the midline and just slide it back and just kind of scan across the occlusal surfaces, okay? Now, I'm being a little rough with my Dexter because it's hard with rubber cheeks, okay? But that really should kind of go behind the last molar, and most importantly, make sure you've got it back far enough. Now, I'm going to tell you that probably as I'm doing this now with live patients, I really try to get them to open up a little bit wider just to make sure, but I'm going to glide it back. Now, let's look at it here on our patient, okay? Same thing. We're going to just kind of seat it in there, and we're going to glide it on the occlusal surfaces and just glide it back. Slick, just kind of roll it back. And one of the things we do is we practice on each other. When we've got this, we practice, and that's really important. I think everything, again, practice, practice, practice. So it's flawless, right? You're just gonna kind of coast it right on the occlusal surfaces and then light up. Listen, this is bright. This is what is so crazy about that's like, is that we can really see, as you can see here, right? And again, light everything up. Now we have 3 different levels of light, which you'll see. And you can really make a choice of where you want to be. And sometimes I even ask the doctor, hey, which one do you want? And I'm going to tell you, on Monday, sometimes he's like, Shannon, turn it up on high. I can't really see. The other thing is, towards the end of the day, we notice that we actually turn up and illuminate a little bit more. And it's kind of funny. We joke about it, but it is true, and I think that's where, again, you have the control to do that. The best part, too, is if we're doing any bonding, right? Any bonding procedures. This was where, again, I love that, sealants, direct resins, we're doing attachment placement. Again, sometimes you can really look at these areas and say, oh my gosh, great isolation, but most importantly, we don't have to worry about reaching up and turning the light off. We've got that illumination, but again, we've got the control right in the patient's mouth. And so here we're actually delivering 2 crowns, able to get in there and again, keep things really dry, but it's very comfortable for the patient. That's the most important thing that we want to be focused on is it comfortable? Let's talk about hygiene. My best friend, very best friend, Lynn Atkinson. Honestly, I have to give Lynn all the credit. She was the very first person to ever tell me about the Isolite. And I mean that. She teaches laser dentistry. She is on the board for the ALD. She teaches so many hygienists that are in school about lasers. And we know that just about every state now, hygienists can, perform LBR. And this is something that, Lynn, when she told me about it, I was like, oh my gosh, she said, Shannon, forget all the HVE devices. This is really the one that we're using. And so I want to just kind of showcase that. She said, if there's one thing that I will never be able to work without, maybe 2, is she said, the Isolite and her laser. And she said, there's no way. She says, when we're training hygienists, we have to have this. It just will not work. And she says, you talk about all the time that it takes in the op. This is where, every hygienist has to have this. And so when I went to work in my big practice with 7 hygienists, my doctor said, Shannon, we don't have that kind of money to put this in 25 ops. And I said, you better be thinking about this. I said, because if we're doing accelerated hygiene, there's no choice. We have to have something like this for our hygienists. And I'm going to tell you, this was the biggest attaboy, Shannon. Thank you so much from my hygienist when we brought this in. And I got to give Lynn the credit. Even, again, thinking about it, trying this out, I will tell you that she has so many videos and so much training, but you'll never see a video without her utilizing the Isolite. And that's what she told me. She said, Shannon, I can't work without it. And when she does, this is really funny, when she does fill in, she says, I take it with me. I thought that was hilarious. And so she says, I just put a little bit of vitamin E oil on the lips and then we're ready to go. And I thought, oh, Lynn, thank you so much for letting me share this. But I thought, how great is that? Now, let me show you the last little component here of this device. Now, it has this anterior component that, again, is very new to most of us, right? Basically, what it does is it fits right under the patient's lip. And by having this, you can see here, the patient really lip just kind of folds over it and doing direct resins, direct bonding. This is amazing. Preparation, all of that. And again, going back to Brenda, talking to her, I was like, hey, Brenda, have you ever seen the anterior? No. She said, I had no idea. I'm like, oh my gosh, you got to see this. I didn't even know until I got the Pro. So again, looking at it, which is really neat. And again, shooting that today, I just kind of shot some, I wanted you to see it at the chair, but I'm going to play this one more time. It just, you pinch it and basically place it in. And again, you do have to switch out the adapter. We're going to use the anterior now. And the patient just closes on it just like that. So super great. Again, having that anterior component. And again, a lot of practices don't know that they have this. So when we compare this to the traditional versus modern isolation, again, all the scenarios are sealant, posterior class 2, endo, CAD-CAM, pediatric, again, short attention span. I'm going to tell you, there's no way on God's green earth that I could do any type of sealant placement. Even in working in pedo, I have to give pedo assistants and hygienists and dentists so much kudos. They don't get any attention and they don't hardly get any love from us. I couldn't do it. This is something that is an absolute must. And again, even for, having attachments or whitening, but those cotton rolls easily dislodge, they roll out. This is where, again, we really and truly want to think, like, what is the best way for us to keep these areas isolated? And tonight was really about just showcasing all of those for you, because again, sometimes all we're doing is showing you clinical procedures, but you only know what you see. And if you don't really, again, have the chance to really have someone that's not trying to sell you on something, I want you to understand all the differences that you have that, but most importantly, I teach being efficient at the chair, passing instruments, being ready, taking photographs of your setups, making sure your assistant is not getting up, right? That's something I absolutely hate. Every time we get up to go get something, we have a little jar for that. We call it the get up jar, right? And I'm going to tell you, most of the time is assistants having to put money in that. But this is time management, and everything is about time. And so, laying this out, this was actually just a copy and paste from our catalog that we put together on time efficiency, and really making sure that everything has a checklist. And again, in dentistry, it's all repetition. It's all repetition, but this is something that I think also having the scripts, because trying something new and most importantly, getting the patient acclimated, having the chairside conversation scripts are very important. This is a soft mouthpiece. It's basically going to keep your mouth safe, but most importantly, suck out a lot of that water. Because I know as a young assistant, that was the biggest complaint from patients is, oh my God, you're going to choke me to death. I'm going to die from all this water, or suction. And this is where, again, I see a lot of memes and a lot of people making fun of patients, right? They want to close on our suction. They want to talk the whole time too. If you got a talker, oh my gosh, you just hook up that and stick it right in their mouth, right? And we can roll. And that's sometimes my doctor will look at me and say, "You ready to place it?" Yeah, I'm ready to place it. Let's get it in there. We joke, but it's like everything is time. And if you think about it, right? If you know that we're going to rock and roll now with the anesthetic that we have, we don't have to get up and go out of the room. The doctor can anesthetize and we're ready to roll. This is when you look at me and we got it down to a science. You ready? I'm ready. All right, let's get it placed. And we just put that right in and we're ready to rock and roll. And I think that this is where, again, when you look at cost versus what's going to come from it, this is where you got to outweigh what works best for you. And again, having those procedure flows is something that we're really good at, and we train assistants to do this, because at the end of the day, everything we do is repetition. And remember what I said, anything that's new, you got to try it 5 times. You got to try it on yourself. You got to know what it feels like. You got to know what it tastes like. Everything in dentistry pretty much tastes nasty. We know that, but I think sometimes they feel like if they put flavor to something, we're not going to use it. But the team needs to know what it feels like. We can't talk about your dentistry if we don't have it and we don't know what it's like. Taking photographs, putting something in someone's mouth, we got to put it in our own mouth first so we can talk about it. And most importantly, be an advocate. But the other piece of this is the patient that was in some of the videos was me. And so for me, I want to know what it's going to feel like. I want to know, again, how to place it. But most importantly, once it's been in my mouth, I know, again, how to be a better assistant because I know what it feels like. And again, I was the patient. So that to me is very, very important. So what is advanced isolation at the end here is that, you cannot tell yourself, and I hear this all the time. And so I put up a couple of bullets. What I hear a lot of times is I'm too old to change. I'm too connected to the old way. We can't be like that anymore. But one of the things that I think is very important is that, we've got mutual respect for each other. And this is something that's very important. And again, I think a lot of times we say no to different new things because we didn't try it out more than once. And again, a lot of times when we say no, we're not competent in those techniques. And listen, I get it all the time. I'm a dental assistant. I'm training dental assistants. I get the Heisman every day of the week, sometimes more than once. But what I want you to understand is once we train on the techniques and the utilization, again, going back to, we don't read words, but we'll watch photos and we'll watch videos. And that's what we've done. We give videos because, again, we're in a video world, right? We're on Instagram, we're on Facebook, we're on TikTok. We want to look at videos, but most importantly, the diagrams are amazing, but we've got to know how to do that. It seems like a nuisance that will not last for long. If your team members are saying that, well, guess what? This is where repetition comes in. No matter what, it is protocol. The setup is part of every setup. That's what it's got to be. And again, looking at that routine, is it something you're doing every single time, not sporadically, right? That we do a lot in dentistry. We're already exhausted. Our time is saturated with so much technology already. Remember that having the light, having the retraction, at the end of the day, we're going to work faster. We're going to work smarter. But most importantly, we're not going to be as tired, right? I'm not wrestling with a tongue that wants to be in the show every single time. And most importantly, it goes back to that equipment, right? When we think about something really, really cheap versus something that, yes, we might be spending a little bit more money for, but at the end of the day, this is where, again, we're going to look at cost factor and is it making us efficient? And there's too many people that will tell you, including myself, that it will help and it will help you be efficient. But most importantly, think about the remakes. Cotton rolls, in my book, calls remakes because cotton rolls are what's going to allow that saliva to creep in. So I'm using isolation devices because I don't like remakes. And it's not even my practice before, but now I do have my own practice and I do and am a partner in a dental office. So I am paying the price and I want to make sure that my team knows that we're going to have full isolation. We don't want remakes and we don't want to have to go through that. But most importantly, I would tell you, most patients, almost all, would tell you this is very comfortable. So isolation isn't just a product, it's workflow. Everything in dentistry, we hear this word now all the time, workflow, workflow, workflow. It's not digital. It's everything we do. And that's what's going to drive our clinical quality. The ergonomics, think about your team. Do you want them to be with you your whole career? Now, some team members, you might say no, but most team members will stay with you if you give them the tools to be those things that we talked about. But most importantly, thinking about what's going to help them. And I think that's got to be your approach as a dentist, to say, I'm doing this for you. I don't want you bent over like that. I don't want your back. I want you to stay in my practice, right? Right now, we have such a shortage of dental assistants and dental hygienists especially. But I'm going to tell you, in my big practice, our hygienists have been in that practice for over 20 years. They don't leave. And part of that is because we're giving them all the tools they need to be successful, but most importantly, not wear and tear on their bodies. And then also the added benefit is that patient comfort. So I hope that, again, you enjoyed this tonight. I know that this was a lot to go through. I hope that it kind of opened your eyes to different things. And again, most importantly, anything that you need help with as far as those products go, please let us know. I think that's something that, again, I'm always here for. This is my website. You can reach me there. We do a lot of assistant training. We train on various procedures, but most importantly, being efficient at the chair and helping you with really all the videos and anything else that you might need. I'm always here for you. And I will say that I want to thank Viva for having me. I've done several webinars, and it's been an amazing time, and I love what Viva does. So I appreciate that so much. And at the end of the day, I do appreciate Zaris for sponsoring me, but most importantly, believing that it's very important that we talk about those efficiencies. So one of the things that I want to make sure at the end of the day too is that you get, and I answer all those questions for you. So I want to just make sure that, again, if there was anything that we didn't, I'm going to kind of go back to that and just kind of stop here so I can see my questions and answers here. Let's go back from the top. St. Pete from St. Pete, Ripla. Oh, thanks. Oh my gosh. Thanks so much, Elizabeth. How do you manage a gagger while placing the isolite? This is where, again, I put the we make sure they got their own chapstick. We're going to glide it. And I mean that, wet it. Okay. This is something, again, a lot of people don't do. Wet it. All right. I mean that. I mean, honestly, I will tell you that when Cindy first put it in my mouth, she did not wet it. So it does kind of jump. But once you wet it, make it really smooth. Now, again, don't put Vaseline on or anything like that, but wet it with just some water and glide it. And again, glide it. And if you want those videos, I'll give it to you. I mean that. I'll make sure you get it. Let's see. Do you use isolite when you do iOS scanning? It's hard because, remember, it depends on what scanner you're using or what you're using it for. If you're doing CAD/CAM, absolutely you can use this. If I'm utilizing the iTero scanner to scan for full-on records, it's hard. I don't want to have to take something in and out of the patient's mouth. And so for that, and just being brutally honest, for Invisalign, I am not going to use the isolite. Okay, I'm not. But I will tell you, for CAD/CAM, the prime scan, you're doing a lot of CEREC. Shoot, yeah, absolutely. That's how this got started. That's how really the isolite became so popular. So, but again, if you're doing full mouth scans, we know right out of the gate, it makes it really tough. Whitening, I will say, is also tough because, yes, I love pushing the tongue back. But I will tell you, if the patient does bring their lips around that anterior ring, I get worried. So sometimes this might not be the ideal for that. But listen, your life will change with anterior preparation and anterior delivery. You're not switching out cotton rolls midstream. I think that was the biggest hurdle for my doctor, is taking out a cotton roll right underneath the lip, right in the middle of a bonding procedure, right? When we remove that, we are taking a chance of the lip touching the teeth and getting them wet. And it only takes one little moisture drop, right? We're already getting also the aerosol. Think about the aerosols in the air, but what about the aerosol from the throat, right? The moisture from the throat that nobody really talks about. So that's where I want you to really think about that. And where do you put the chapstick on the isolite, or do you just put it on the patient's lip, just the patient's lips? Yeah, I'm wetting the isolite with water, just kind of spritzing it, just making sure that it's just a little bit slick to, again, slide on. This is where, honestly, practice, okay? And again, I know that, again, these ends are disposable, but find which one fits your mouth. You got to measure your own mouth first. I got a big mouth, okay? So measure your mouth and practice placing it in your mouth. The more that you practice on yourself, that will all go away. A lot of times when we have issues placing it, it's because we never put it in our mouth. And so that's something that, again, I think is really the answer, is you doing that. But if you have patients who have anxiety, this is where, again, I feel like when you tell them, listen, we're going to take away that anxiety because we're going to make sure that all the water in your mouth is sucked out. You're not going to have to worry about, swallowing a bunch of these chemicals, things like that, because we're going to utilize an amazing device that's very comfortable, but most importantly is going to help remove any of that saliva and water spray that we're doing from the handpiece, and also when I'm trying to clean the field for my doctor. And let me tell you, do you know we've gotten reviews because we were using the Isolite? I should have put that in the program. We've gotten reviews from that. And we also shoot a video on it as well, so patients know all the technology that we have in our practice. Don't just talk about your camera and your scanner. Talk about this as the doctor. Maybe shoot, why do you use it? As the hygienist, why are you using it? As the assistant, why are you using it? Again, patients want to see us, and most importantly, we want to make sure that they understand what to expect and all the things that we can do for them. So again, I think that this is where, again, rubber meets the road. You got to try it in. And again, looking at all of the questions tonight, and if for any reason you have something that maybe comes up, feel free to reach out to me. I'm always here for you. And again, it was a pleasure. And I hope to maybe see you, check out some of the other webinars. And most importantly, let us know what webinars you would like to have. If you don't voice your opinion and what you would like, you can't get mad at maybe something that we didn't offer. That's really important. And so thank you so much on this Monday night. I hope that you guys have an amazing rest of your week. And for those that are watching after tonight, until next time, thank you so much.